Thigh skin laxity is an aspect of plastic surgery, and here's how plastic surgery addresses and corrects it. We are here today with one of Costa Rica's finest plastic surgeons, renowned for his extensive experience and specialized expertise in body contouring. Doctor, why is it so incredibly difficult to tighten the skin on the inner thigh?
Yes, well, it is generally an area that tightens up less effectively than other areas do, for example, after a liposuction procedure. So if there's a certain degree of skin redundancy in that area, you could undergo liposuction and anticipate some improvement in skin tightening, a certain percentage. But if you perform very aggressive liposuction in that area, you can expect them to have even more laxity. Therefore, another surgical procedure will be necessary at that point in time. But, well, it generally depends on the individual patient. So if we're discussing a patient who only exhibits a slight degree of skin laxity and is generally in good health, without significant weight fluctuations, then a small amount of liposuction combined with certain procedures designed to help contract the tissue could certainly yield positive results. But if it's a patient who has experienced post-bariatric weight loss, significant weight loss, such as after morbid obesity or similar circumstances, the tissue is usually excessively redundant, and that patient will undoubtedly need surgery. Generally, we don't initiate the surgery by addressing the thighs.
You start somewhere else when a patient like that comes in, right?
Yes, because the vectors are going to be different.
Where do you?
Typically, we usually begin with the abdomen. Many times, just performing a good abdominoplasty will improve a lot of the redundancy in the thighs. Because of the pulling you do with the abdominoplasty, it improves a lot. However, many will also require a thigh lift surgery. And this will also depend on how much redundant tissue there is. There are patients who could do well with just a scar at the inguinal level extending towards the posterior. These are the patients who only have just a little bit of redundancy or, so to speak, looseness. The laxity is mainly in the vertical direction. However, many other patients have excess skin not just vertically, but also horizontally. So simply making an incision in the groin area alone won't suffice for these cases. So there's a procedure now known as a spiral lift. In those cases, the patient needs to be aware that she will have a scar running along the entire inner part of the thigh. It is a scar that is shaped like a cane or a J, extending from the inguinal region all the way down to, typically, a few centimeters above the knee. However, this method allows for a very precise adjustment of the thigh, addressing both vertical and horizontal aspects effectively. And they turn out very well. They turn out really well. It's a big relief, especially after dealing with such significant thigh skin laxity, which causes many difficulties in daily life. Having a scar like that, but having your thighs tight and looking good, generally the patient feels happy.
Of course, an incredible relief. They feel relief, lightness, and mobility changes so much. And also, how these individuals feel about themselves too. So doctor, what is the recovery experience, or what can realistically be expected regarding the scar healing process after a spiral thigh lift procedure?
We find that with that spiral technique, most patients, they do quite well. However, it's crucial to always explain that, especially in the inguinal area, it's a moist region, making hygiene quite challenging in all that entails. We could sometimes have wound dehiscence, or the wound could open up. It's something that could happen, but it's because it's a difficult area, a moist area right there.
So more caution is needed.
One must be very careful. During recovery, naturally, the patient will receive all the necessary advice and warnings, but it's an area that's difficult to heal for that reason.
So that can be expected, is what I mean. That's what I wanted to hear. That you can expect this to happen, and if it does, it's normal. It's normal there.
Yes. Generally, sometimes there are small dehiscences, so most of the time they are minor and just require wound care. And it generally heals up well in the days that follow.
Well, Doc, thank you very much for this valuable information regarding thigh skin laxity, especially after significant weight loss. Thank you so much.